everyone, welcome to part two of the kind of health and safety debrief, I guess. As you know, we discussed that there's some updates around health and safety. So in part one last week, we covered, considerations for the environment and for patient safety. In this one, I just wanted to give a bit of an update from a practice standard scheme perspective. So those of you that obviously work in practice, in veterinary practice, those that are recognised by the RCVS, there is a practice standard scheme in place where essentially they just check off, that for every activity you're doing in the clinic that you abide by certain guidelines. Long story short. So they recently added laser therapy to this guidance because of obviously lasers being more and more common. So they've added in what they believe to be key things that a clinic must have in place, particularly from a health and safety point of view, to make sure that they're abiding by all things legal. So the key control measures that's within the PSS standards now is that obviously, and these are things that we already know, but it's just having these kind of in one place. But obviously PPE, so for eye protection for therapeutic lasers, obviously that eye protection needs to protect against the specific wavelengths for the device that's used. That's for therapeutic lasers. It does also cover surgical lasers because obviously there are extra requirements in terms of gloves and extra PPE required for that. But from a therapeutic laser point of view, first one is eye protection for your PPE. Second one is designated space. Now, designated space, that can be, that can move across the clinic, but it's just that space is, it's looked at so that we know it's an appropriate space to be able to perform and that we have all of the different measures in place. So that could be a consult room, it could be a theatre, x-ray room. It does not have to be lead lined, so important point there. But it's making sure whatever space is used, it has the appropriate signage so that people can't just walk through and obviously walk past the area in which you'll be treating. So whatever space is, looked at as the designated laser spaces within the clinic, it can be multiple areas, but it just has to meet the requirements, have the appropriate protection. So if there's windows, having blinds, it's little stainless steel surfaces and reflective surfaces, and if there are reflective surfaces, having things to protect against reflection, so putting towels, blankets, things like that over. And like we say, having warning signs so that there's no thoroughfare, people can't just walk through as you're lasering midway through. So that's the second one. Protection from nearby workers from what's called AOR, which is artificial ocular radiation. Again, that's making sure that people walking past can't be accidentally, if they haven't got their eye protection on, the laser does not pass through their eyes. So again, windows, external windows, having blinds so that anybody that's on that outside of that window, they can't look in and be, aimed directly down that laser beam. That's and that could be internal or external windows there. That's obviously making sure that anybody in the nearby, in that non-ocular hazard distance, they have the appropriate eye protection on. So there's that one. Then it's policies in place for if it goes wrong. So like with everything, we always have policies in place for if something does go wrong, what do we do about it? So if someone was to get exposed, what is the protocol for that person? Having a laser supervisor, a laser protection supervisor in place. So obviously within the clinic, having somebody nominated who is that laser protection supervisor. We talk about this a lot in terms of health and safety, having someone within the clinic that just makes sure you stay within compliance and that everything is kept up to date, everyone is trained, all the PPE etc is kept up to date as well. So that would be someone that you'd name, and then have a log of use for AOR, so your artificial ocular radiation. Bit like those of you that work with x-ray radiation, we keep a log of that exposure. Same with artificial ocular radiation. Whether it's not necessarily clear whether that has to be paper form or whether it could be, you know, many devices have patient trackers these days. It's not necessarily quite clear, but I would say to give backup, having a separate log. So the key documents you then need in place: artificial optical radiation log, standard operating procedures specific to your clinic and your device, laser training record for all staff using the laser to verify that everybody performing laser has been trained, and risk assessment for your specific device for your specific clinic. So those are all the requirements that the RCVS have put out in terms of the practice standard scheme and what they expect. So hopefully that helps summarise that up. I have put templates of these documents together. I was hoping to get a link up, so hopefully I will, by the time I actually write this post, I will have a link up for that. If not, drop me an email, but I will put it in the message above my head to see where I'm at by the time I actually post this. But either way, I do have templates of these documents, which I'm more than happy to share. Hope that helps, and see you guys next week.